Hello, my name is Karen Wendell. I'm a healthcare provider at the Denver Sexual Health Clinic and part of the Colorado Center of Excellence for Antibiotic-Resistant Gonorrhea. In this video, we'll provide you with guidance on how to collect a gonorrhea culture. Gonorrhea cultures can help you evaluate patients for antibiotic resistance. You should consider collecting a culture if a patient fails to improve after standard treatment, has a positive test of cure after treatment for pharyngeal infection, or if a patient has been exposed to a person with known antibiotic-resistant gonorrhea. The Colorado Center of Excellence for Antibiotic-Resistant Gonorrhea can assist you in obtaining the culture test and assuring access to antimicrobial susceptibility testing. Please contact us prior to collecting a culture. Gonorrhea can be difficult to grow, and we want to ensure that we optimize the collection and handling of the sample so that we can get good culture growth and antimicrobial susceptibility testing.
In this video, we'll describe the test kits that you can use to collect gonorrhea cultures and the best practices for collecting samples at the genital and extragenital sites. At Denver Health Clinics, we use either our sterile cotton applicator or flux swab for gonorrhea culture collection and immediately inoculate the swab onto our culture plate. The culture plate, along with the CO2 tablet and label, needs to be placed in incubator, usually within 10 minutes. The need for an on-site incubator and a carbon dioxide environment make gonorrhea culture plate testing logistically challenging for most clinical settings. For this reason, we recommend using a swab specimen collection and transport system. For best results, store the swab at room temperature after inoculation and assure that the swab arrives at the lab within 24 hours of specimen collection. We accept 5 culture swab collection and transport brands. Now we are going to explain how to collect gonorrhea cultures at pharyngeal, rectal, and cervical and urethral sites. To collect the sample at the pharyngeal site, ensure you have a good light source that can be focused into the back of the mouth. Have the patient sit on the exam table, tilt their head back, open their mouth, and stick out their tongue. Sometimes having them say and hold the sound "ah" can help move the tongue out of the way. Without touching the side of the mouth, swab the posterior pharynx and tonsillar arches with a dry swab. It is important to make contact with 5 points: the right and left tonsils, the right and left posterior wall, and the uvula. To collect a sample at the rectal site, have the patient remove their clothing and lean over the exam table. Separate their buttocks and insert the dry collection swab approximately 3 cm, about a quarter of the entire swab, into the anal canal. The swab must pass the dentate line about 1 cm from the anal openings to swab the columnar epithelium. Second, rotate the swab, making contact with the anal canal for at least 10 seconds. To collect a sample at the endocervical site, ask the patient to avoid intravaginal creams, medications, douches, or suppositories for 24 to 48 hours before sample collection, if possible. After positioning the patient supine with the feet in stirrups, a spigram should be inserted. To visualize the cervix, insert a dry swab approximately 2 cm, the entire tip of the swab, into the end cervical canal. Rotate the swab against the wall of end cervical canal for at least 10 seconds. When you withdraw the swab, make sure not to touch the vaginal surface. Then insert the swab directly into the tube collection system. To collect a sample at the urethral site, the patient should avoid urinating, if possible, for 2 hours prior to sample collection. If a patient is having penile discharge, you can collect the exudate without inserting the swab into the urethra. If a patient does not have visible discharge, one hand should hold the penis and the index finger of the other hand should be used to move discharge forward to the meatus by stripping the urethra from the base of the penis to the glans. Then gently insert a dry swab into the urethra, approximately 2 cm, the entire tip of the swab. You can also use a preservative-free dry swab such as Optima unisex swab, blue swab, or flux swab. It's important to label each culture swab collection and the tube collection system for swab transport with the patient's name, date of birth, collection time and date, and the anatomical site of collection. You will need to fill out a separate lab requisition form for each culture. Let's review important steps of collecting a gonorrhea culture. When you suspect gonorrhea treatment failure or exposure to antibiotic-resistant gonorrhea, request a gonorrhea culture from the Colorado Center of Excellence for Antibiotic-Resistant Gonorrhea, CCOE. You may also request clinical consultation if needed. Ensure you have access to one of the approved swab specimen collection systems and the tube collection systems for swab transport. If you don't have these in your clinic, you can request a supply from the CCOE. Collect and label the sample appropriately. Complete the lab requisition. Coordinate with CCOE staff to ensure that cultures are delivered to the CCOE lab within 24 hours of collection. Please use the contact information on the CCOE website to reach us for next steps and to address any questions.